Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month I'm talking about what it's like to be a finance leader and have a loved one who is a patient. Yes, it does. Many of us have already accompanied our parents or other relatives on their journeys through the healthcare system. I often talk about how important it is to look at healthcare through the eyes of the patient. But when the patient is also your mother or father, that's not an easy thing to do. When my good friend Mike Freed, a former HFMA board member, shared his blog post about his family's experience with the healthcare system, I wanted to share it with all of you as well. Mike wrote about his grandmother's death from complications of a simple urinary tract infection. But the UTI wasn't the root of the problem. It was actually a matter of a lack of primary care and home health support, of being hospitalized unnecessarily, and all the risks that go along with that. You can read the whole story on the HFM blog. At the time, Mike vowed that nothing like that would happen to his mother. But sadly and incredibly, 20 years later, it did. I believe these situations can be prevented, and I know Mike does too. What we're asking ourselves is, why is it taking so long? This isn't rocket science, and we can't blame it all on misaligned incentives either. The core problem, as Mike sees it, is a lack of leadership. Our leaders need to have the commitment and the persistence to adopt a truly patient-centered model of care. What struck me in thinking about Mike's experience is that the real story doesn't come through when we talk about it in finance speak. It isn't about models or outcomes or incentive alignment. The real story is about how our elderly parents will spend their final few years and ultimately the final months and days. And that story isn't going to change until we look at the healthcare system, and that includes end-of-life care, through the eyes of the people who experience it. So here's the elephant in the room challenge to all of us. Why does it take a story about a mom or a dad or anyone close to us to paint this picture? Don't get me wrong. The healthcare industry is full of loving, caring, compassionate people. But with that the case, how does this happen? Yes, and that's where change leadership comes into play. To combat the pull of the urgent and focus instead on the important, we've got to stay grounded in the real-world impact of what we do. We need to look for ways to stay motivated and do whatever it takes to pick up the pace of change. Let me be clear. I'm not saying we should pursue change leadership at the expense of responsible financial stewardship. But it's important to realize that the two are not mutually exclusive. If you accept the premise that there's plenty of money in the healthcare system, it becomes easier to see that we have the power to go beyond fee-for-service mentality and redirect fund flows to create a higher value healthcare system. I realize that what I just said may sound academic. That's what happens when we fall into using jargon. But it's not academic at all. It's about our parents' future. It's about our future. And if we're going to spare our children the regrets that so many of us have experienced with our parents, then the time to act is now. Thanks for watching. I'll see you next month.